Hello everyone and welcome back to my YouTube channel. So today's important practical questions. It is a video that will help you to understand what are the important viva questions for 5th semester practicals in B Pharmacy according to the PCI syllabus. So the first subject is Pharmacognosy. In Pharmacognosy, basically there is a similar pattern for few 7 to 8 drugs that are in the beginning, that is senna, fennel, coriander, cinchona, cinnamon, clove. So these are the few drugs that you have to study the macroscopic and powder characteristics. Basically, there are few important terms that you have to remember about trichomes, starch grains, calcium oxalate crystals, and the stomata. For example, there is presence of a parasitic stomata in senna, and also there is presence of a covering or clothing or non-glandular trichome in senna. So you have to remember this important point about senna. Similarly, you have to remember the biological source. There are two types of senna: Indian senna or Tinnevelly senna and Alexandrian senna. Both are of different sources. One is Cassia angustifolia. The Alexandrian senna is Cassia acutifolia. Similarly, there's a difference between fennel and coriander. You have to remember that this is very important difference. Like in fennel, we have a reticulate parenchyma, which is lignified. But in coriander, we have reticulate sclerenchyma, which is lignified. In fennel, there are total 6 vitae, 4 on the dorsal and 2 on the ventral side. But in coriander, we just have 2 on the ventral side. The 4 on the dorsal side are replaced with lacunae. Also, there is more amount of volatile content in fennel and less amount of volatile content in coriander. They have different substituents as well. Substitutes, like for coriander, the adulterant is Bombay coriander. Also, fennel is an ketone containing and a phenolic ether containing volatile oil. But coriander is an alcohol containing volatile oil, that is coriandrol or linalool. Clove, you have to study about clove, the family Myrtaceae, the biological source, about eugenol. Cinnamon, there are two types of cinnamon: Ceylon cinnamon and Cassia cinnamon. So you have to study the difference between them. Just remember that in Cassia cinnamon, we have cork and a cortex, and it is also called as a Chinese cinnamon. But in Ceylon cinnamon, that is Indian cinnamon, which we also call as Kalmi Dalchini, it lacks the cork and cortex. And also remember that cinnamon aldehyde is a volatile oil as well as a phenyl propanoid moiety. So you have to study it in later part on the theory as well. So do remember. Next is basic principle of paper chromatography. You just have one experiment on these. So it is very essential viva question on these two topics. Paper chromatography is also called as partition chromatography or liquid chromatography. But we are using Wattmann's filter paper, but that Wattmann's filter paper contains cellulose, and that cellulose has moisture. That moisture is responsible for extraction. So that is the reason we call it as a liquid chromatography or partition chromatography. In thin layer chromatography, we basically prepare the sample. We have a stationary phase, either toluene ethyl acetate or any other stationary phase. We have a mobile phase. Stationary phase is basically silica gel G plate for or alumina or fillers earth, and mobile phase is basically toluene or ethyl acetate. Also, we use detecting or spraying reagent like the iodine crystals or the UV chamber, or if there are any if the alkaloids are used, then we can use drag and drops reagent. And next we have to study in detail about asafoetida, aloe and benzoin. In benzoin, there are two types of benzoin, Sumatra and Siam. They have different biological sources. Sumatra is from Styrax benzoin, and Siam is from Styrax tonicensis. Aloe, there are many types of aloe: Curaçao aloe, Cape aloe, Zanzibar aloe, Socotrine aloe. They have different sources. So you have to remember those sources as well. Asafoetida is again a oleogum resin, and you have to study in the theory part as well about combined umbelliferon test, ferulic acid test. There is colophony as well, and myrrh also. but they are not as important. In colophony, just remember that there is presence of an abiotic acid. So it is a oleoresin and a acid containing resin. Next, we have industrial pharmacy. We have to study the three methods of granulation: dry, wet, and direct compression, and also difference between them, like if aspirin is given, so aspirin is a little moisture sensitive, it is a little hygroscopic. That means we will not perform wet granulation. Even if we are performing, then we have to use a non-aqueous binder like PVP in alcohol or something. So you have to remember that kind of conceptual granulation formulation considerations. Evaluation test for tablets, capsules, and parenterals. Parenterals, we have sterility testing like membrane filtration, direct inoculation. We have two medias, FTM and SCDM. SCDM is for fungi and FTM is for bacteria. We have pyrogen testing, which has lal test and rabbit test. Lal test is limulus amoebocyte lysate reagent test, in which we extract this reagent from the amoebocytes of limulus polyphemus crab, which is a horseshoe in shape. Capsules are basically weight variation test is important, and disintegration rate for hard gelatin is 30 minutes and for soft gelatin is 60 minutes. In tablets, there are two types of tests, official and unofficial. Hardness, tablet thickness are some few unofficial tests, but weight variation, uniformity of weight, uniformity of content, content of active ingredient, dissolution, friability, disintegration are official tests for tablets. There's a difference between vanishing and cold cream. Vanishing cream vanishes. There's no hydrated moisturized layer that's present. So it is a O by W emulsion. While cold cream leaves a few thin film, hydrated film on your skin, on the mucus layer. So it is a W by O emulsion. Also, the formulation considerations. We have two phases for a cream: oily phase and an aqueous phase. We have two different preservatives. Oily may we have propyl paraben. Aqueous may we have methyl paraben as a preservative. Stearic acid is a majorly used ingredient for the oily phase, and in aqueous phase we use glycerine and other few ingredients like perfumes for the and few coloring agents as well. So remember the formulation consideration of vanishing and cold cream. Pre-formulation, you also have an entire unit in your syllabus, so do not forget to do this unit. And there are few physical, chemical, biological, biopharmaceutical parameters like particle shape, size, structure, surface area, if it is spherical, if it is non-free flowing, angle of repose, Carr's index, Hausner's ratio, micromeritics, rheology. If you want an entire list, I have uploaded it on my Instagram page. You can go and check out over there. Also, remember that in chemical test, we have oxidation, reduction, hydrolysis, polymerization, epimerization. So you have to know about these reactions in the chemical point of view. In the biological, it is not important. Just remember the toxicity and pharmacological studies. Next, we have pharmacology. Bioassay are of two types, graded and quantile. In graded, we again have matching, bracketing, interpolation. We have cumulative dose as well, but that's not important. In multiple point, we have 3 point, 4 point, 6 point. In 3 point, we have two standard, one test. In 4 point, we have two standard and two test. Just remember this basic classification of assay. Why do we perform assay? How do we use students' organ bath? What are the components of the organ bath? Oxygen delivery tube, thermostat. Remember all of this. Chymographs drums, Sherrington's rotating drum cylinder. Next is classification of parasympathomimetics, sympathomimetic, parasympatholytics, and sympatholytics. This we have already done in the previous semester. Just take example of adrenergic, cholinergic, antiadrenergic, anticholinergic. Okay. Suppose if we'll take example of drugs as well, so we can understand as well. Let's take epinephrine or adrenaline, we can say, as adrenergic drug. In cholinergic, can we take acetylcholine? In anti-adrenergic, can we take a beta blocker or alpha? Suppose we'll take propranolol. That's the most widely used beta blocker, prototype of the beta blockers. Anticholinergic, we can take atropine. That is again a prototype. Or we can take scopolamine or humatropium, ipratropium, any anticholinergic drugs. So, adrenergic drugs जो हैं, they cause vasoconstriction. So they increase the heart rate. Cholinergic drugs, ulta action. Vasodilation, decrease the heart rate. Anticholinergic drugs will oppose the action of cholinergic. That means it will cause vasoconstriction. That means it will increase the heart rate. Similarly, anti-adrenergic drugs will cause opposite action of adrenergic. It will cause vasodilation. It will decrease the heart rate. So we can say that adrenergic drugs and anticholinergic drugs have a similar action of increasing the heart rate. It is also increasing the heart rate. So they can be used in the management of hypotension when there is decreased blood pressure. Similarly, we can say that cholinergic and anti-adrenergic have a similar mechanism. They are both decreasing the heart rate. So it can be used in the management of hypertension. So in this way, indirectly, teachers can ask you a question that which drugs will you use for management of hypertension? So remember beta blockers, which will you used in the management of hypotension. So just remember that you have to just remember that beta blockers is used in the management of hypertension. In the management of hypertension, we use cholinergic drugs. So that's enough. And just remember the small difference between all these four classification of drugs. Next, we have skeletal muscle relaxant, spasmodics, spasmolytics, neuromuscular blocking agents. Again, this is done in the previous semester about nicotinic receptors that are present on the skeletal muscles. And D-tubocurarine is the major drug you have to remember along with succinylcholine. Just remember about these drugs that they are neuromuscular blocking agents or skeletal muscle relaxants or spasmolytics. Analgesic activity by hot plate and tail flick analgesiometer. That's very, very important. You have to just remember about the hot plate method, central, peripheral, and what will be the analgesic activity. So if the pain threshold is more, the analgesic activity is more. If the pain threshold is less, the analgesic activity is less. Suppose take any example of an analgesic drug. Let's take diclofenac or nimesulide or any drug. So before the pain threshold was 5 minutes, but after injecting diclofenac, it will be about 15 minutes, let's say. It's not the 15 minutes, right? It depends upon the pharmacokinetics of the drug, how much it is absorbed, distributed, metabolized, excreted. So just remember, suppose if the pain threshold has increased, so its analgesic activity has been notified. But if we are not in, suppose if we have a test, in that test sample, it is same 4 to 5 minutes only. That means there is no analgesic activity. The pain threshold has remained same. That means it is not having an analgesic activity. Simple. This is the major principle of the tail flick analgesiometer and hot plate. In basically there is analgesic activity seen if the tail is from the flicking of the tail. That is if the tail is moving or tail is not stagnant or whatever. So that's all for today's video. I hope you enjoyed it. You can contact me through any of the sources. I would be really happy to answer all of your questions. These are the Instagram page. This is our YouTube channel. This is the SlideShare page. You can mail me as well. This is my mobile number. If you have any doubts, you can feel free to text me. So thank you so much for watching the video, everyone.